Okay. Hi, my name is Melanie. I am a student nurse, and today the doctor has ordered for an IV on this patient. So we're going to get started here. First thing is first, I'm going to touch the patient, and then I look at their wristband. Can you tell me your name and also your date of birth? And I see that it matches onto the wristband, so that's good. And so the doctor has ordered a primary infusion of normal saline at a rate of 100 milliliters per hour, and I'm going to be infusing a total of 250 milliliters. So before we get started, I'm going to wash my hands, and I'm also going to close the curtain for privacy. And I'm going to check this person's saline wall for any redness or swelling, and I ask if the patient is feeling any pain, and they say no, so we can get started. So I have all my supplies set up. I washed my hands, and so I'm going to put on my gloves. I also checked the patient's chart and their MAR, and they didn't have any allergies or there was no contraindications. So here's the normal saline. I'm going to open it. Aseptic technique. So I look at the bag. It expires October 2017. It's good, not leaking, and it's clear. And I have the primary infusion set right here, which I will open. And now I'm going to just get myself ready here. Here's the clamp. I'm going to close it. And I'm going to get ready to spike. So here's the end that I'm spiking it with. And I'm going to spike the IV bag. So I'm going to take this off. And this as well. And I twist the cap. Alright. I also have to make sure that I label this with a patient ID, and I also label the tubing with the initials and the date. And so I'm going to hang this up to make it a little easier. And I'm going to fill the chamber half full. It's going. It's taking a while.
And raspberry and a cheese.
Okay, so that's good. So now I'm ready to prime the line, and so I have the end here. I am over a garbage bag, assuming that, and I'm going to open the clamp slowly, and I'm just going to follow the liquid as it flows.
Just don't even get it to the sticker. So I was like sitting there trying to wait, and you like knock on the door and he's like, "Are you okay?"
As you can see, it's going, and I keep it open until the liquid reaches the end here. Yes. As you can see, I kind of dripped, but yeah. And so once that is finished, if I see any bubbles, then I'm just going to flick like this. And now I'm ready to insert this in the patient. So I have my alcohol swab right here. So I'm going to use one to clean this end of the patient. And I'm going to be inserting this end.
Okay, so that's so hilarious.
Like that. And I lock it. And then now I need to set up the machine, so like this. Here's the key. Take this out. Lock it in. we can turn on the machine. So this is the primary infusion. So new patient, yes. Labor and delivery, yes. Okay, this is patient A. And so we can go to channel select, and we're going to do a basic infusion, and we are doing a rate of 100 milliliters per hour, and the volume to be infused was 250. So I'm going to put in 250, and I can start. And to make sure it's flowing, I need to unlock here, the primary lock, and also unlock the patient end, which is right here. And I just make sure that it's flowing and it doesn't beep, there's no obstruction, and that there's no infiltration. And then, yeah. So that's the primary, and now we are gonna get the secondary ready. So I can change my gloves, wash my hands. Sorry. And so the medication, the secondary medication is called cefalexin. And cefalexin, so I go back to the patient, I tell them that they will be getting cefoxitin, and cefoxitin is an antibiotic, and side effects include nausea and vomiting, and they will be getting it at a rate of 50 milliliters per hour. And so I check the patient's ID bands, I ask for their name, date of birth, and if they're allergic to anything, which they're not. And so now we're ready to get started for the secondary. So I have the medication right here. I'm going to open it. I check the bag for any leaking. The color is clear. It has not expired. And here's my secondary infusion set. So I'm going to open this up. And I'm going to make sure that I lock it. And I'm ready to spike. So this is the end I'm spiking with, and this is the cap. So I take it off. Take this off. And I twist. Alright. And then I'm ready to hang this, so I just want to put it up. That's the secondary, and I want to put the primary lower, so I'm going to use this. And here's my secondary end. I need to prime it. So in order to do that, I fill the chamber by like a half. Just like that. And now I'm ready to prime the line. So I slowly open. I'm over like a garbage bin. And I watch the liquid as it flows down. It's going slowly. I also don't want to waste medication, so I should go really slow. It's almost at the end. Once it reaches, I stop. And if there's any bubbles, then I would flick. And so this end, I would have to attach it to the primary line end here. So this is a little bit. So that would be right over. Ooh. Hold on. This is primary. Oh, right here. My bad. Okay. So I need to have an alcohol wipe. Yeah. I opened a new one. And then I just clean this off. And I pop this out. and I can connect it. Well, before I connect it, I have to make sure that the primary lock is off so that there's no more primary flowing. So it's locked like that. And then I insert. Okay. And so I need to set up the machine for a secondary infusion. And so we're back here. Let's go to channel select, secondary, and then our drug is not listed, so I have to press basic secondary. And so the rate was 50 milliliters per hour rate. And the volume to be infused was 50 milliliters. And then I press start. And I need to open right here the secondary. So I open it, and then I have to open the primary lock. And I make sure that the lock on here is open as well. And I check the chambers, and I see that secondary is dripping. And that primary right here, which is lower, is not dripping. And so that's flowing to the patient, and I just have to assess for any side effects and if there's like inflammation or infiltration. And that completes the IV setup.